We've all been there, right? Sitting in the doctor's office, getting a checkup, maybe a prescription. But have you ever really stopped to think about what happens to all that information after you leave? Today, we're going to pull back the curtain and look at how your health data gets organized, specifically right here in the Philippines. It's this huge, invisible system that's working behind the scenes to keep all of us healthier. Seriously, think about it. That lab result, that prescription, that little note the doctor jots down, where does it all go? Well, today we're going to explore just that. We'll see how these little bits and pieces of your health story come together to create a much bigger picture, one that actually has the power to improve the health of the entire country. So, what it all boils down to is this concept: health information organization. The main goal here is to take what could be a total mess of individual records and turn it into a structured, super useful resource. A resource for doctors, for hospital administrators, even for public health officials. It's kind of like taking a library where all the books are just thrown in a pile and meticulously organizing it so you can find exactly what you need in seconds. Okay, so how does this system actually get built? I mean, this doesn't just happen by accident. There's a national strategy, a real blueprint that's designed to connect all these dots. And the foundation for this whole thing? Well, it comes down to one really important piece of legislation. Yep, the engine driving this whole massive change is the Universal Healthcare Act. This is a landmark law, and it actually mandates the creation of integrated electronic health records all across the country. The big idea? A future where your health information can follow you securely and seamlessly, no matter which clinic or hospital you go to. And where does all this data actually go? Well, it flows into something called the National Health Data Repository, or NHDR. You can think of this as the central brain for the country's health data. It's a secure, centralized place where information from thousands of clinics and hospitals is all brought together and stored. So, the process itself is actually pretty logical. First, doctors and nurses collect your data. Then, that data gets sent in a standardized way to the National Repository. And finally, public health officials can look at all this data together. Let me give you a real-world example of why this is so powerful. Imagine a bunch of hospitals suddenly report a spike in dengue cases. By analyzing the data in the NHDR, health authorities can spot that outbreak way earlier than they could have before. That lets them jump into action and start prevention campaigns. It's a perfect case of how organized data can literally save lives. Now, for all these different systems to be able to share information, they all need to, speak the same language. This is where standards become so incredibly important. Think of them as a universal translator, but for health data. A really key idea here is something called metadata. I know, it sounds super technical, but it's actually pretty simple. Metadata is just data about other data. So imagine you have a file folder. The papers inside, that's your data. The label on the outside of the folder that says who created it, what the date is, and what it's about, that's the metadata. It gives you the context you need to understand what's inside. So let's make this more concrete. For example, a unique patient identifier makes sure your records don't get mixed up with somebody else's. Super important. The date of service tells us when a checkup happened, and the data source tells us which clinic or hospital it came from. This is the kind of metadata that turns a jumble of raw facts into truly meaningful information. Now, to make all of this work together, we rely on international standards. AGIL 7 has been the go-to for years. It's a solid, established foundation that lets different systems talk to each other. But technology is always moving forward, and that's where FHIR comes in. That's FHIR. It's the modern upgrade. It uses the same kind of web tech that powers your favorite apps to make sharing health data way faster and a whole lot easier. Let's try to follow a patient's journey to see this in action. We'll call him Juan. So, when Juan visits his local clinic, his info gets logged into a system called iClinicSys. If he ever gets admitted to a public hospital, his records there go into IHOMIS. And when that hospital files an insurance claim for his stay, they use the PhilHealth eClaims platform. It's those data standards we just talked about that make it possible for all these different systems to understand each other. Okay, so collecting tons of data is one thing, right? But making sure it's good data, that's a whole other ballgame. The quality of our health information really stands on three essential pillars. Let's break them down. First, and you could argue this is the most critical, is accuracy. The information has to be correct. It sounds so simple, but the stakes are incredibly high. Think about it. An incorrectly recorded diagnosis could lead a doctor to prescribe the completely wrong treatment. The consequences there could be really serious. The second pillar is currency. This just means the information has to be up to date. Why does this matter? Well, imagine a doctor looks at an old medication list. They might prescribe a new drug that has a dangerous interaction with something a patient is taking right now. So having current info isn't just a nice to have, it's absolutely vital for patient safety. And pillar number 3 is completeness. This means nothing important is missing from the record. The classic example here is allergy information. If a patient's allergy to penicillin isn't written down, a doctor might prescribe it, and that could lead to a severe allergic reaction. Incomplete records create these really dangerous blind spots in a patient's care.
So, building a fully integrated nationwide health data system is a huge job, and it definitely isn't without its challenges. It's very much a work in progress, and there are some pretty big hurdles we still need to clear.
One of the biggest issues is that a lot of health systems are still fragmented. They just don't talk to each other very well. This is why you might have to get the same lab tests done all over again if you're transferred to a different hospital. Their systems just can't share the info. On top of the tech issues, we also need more trained professionals to manage these systems. And of course, there's the constant, incredibly important challenge of making sure all this sensitive data stays private and absolutely secure. So, after all that, what's the big takeaway here? It's really simple. Getting our health data organized isn't just some boring technical task. It has a direct impact on how we get treated as patients, on our ability to spot and track diseases, and on the health policies that affect all of us. At the end of the day, it's as straightforward as this. Better data really does mean better health for everyone. If you found this explainer helpful, inspiring, entertaining, and informative, please go ahead and share it, give it a like, and be sure to subscribe. And keep an eye out for our next upload. Thanks so much for watching.